Hello guys, welcome back to my channel. And if you're new, my name is Olaoluwa Fajimi. I'm a portfolio GP and training program director based in Coventry. By popular demand, I have started a new series on annual review of competency progression, ARCP. So if you haven't seen my video on the introduction to ARCP, please do well to see it, most preferably before seeing this one. In this video, I'm going to be explaining 7 main reasons why trainees fail ARCP. Number 1 will be missing evidence. Missing evidence is perhaps the commonest reason for a non-standard ARCP outcome. As you know, there are specific evidence and competencies set out in the RCGP curriculum that each and every postgraduate doctor in training is expected to meet. Failure to meet any of this is what is called missing evidence, and it's the leading cause of a non-standard outcome. So what are those evidences we are looking for? Number 1 will be the clinical case review, and the RCGP expect 36 of this clinical case review in every academic year, making a total of 108 entries by the end of your training. Second of this will be mini-case or court, and we expect 4 of these in ST1 and ST2 and 7 of these in ST3. Third will be case-based discussion, or what is now called CAT, and we expect 4 of these in ST1 and ST2 and 5 of these in ST3, making a total of 13 before CCT. We expect multi-source feedback, 1 cycle containing at least 10 responses per ST year, making a total of 3 before CCT. We also want a colleague feedback, which we expect 1 in your ST3 year. Clinical supervisor's review, we expect 1 per post. And in terms of patient feedback, we expect to have 1 in your ST3 year. In terms of the QIP, we expect 1 either in ST1 or ST2, and we expect 1 QIA as well, either in ST1, ST2, or ST3. Any academic year that you do a QIA, we do not expect you to do a QIP in the same academic year. In terms of the placement planning meeting, we expect 1 per post, and in terms of the learning event analysis or significant event analysis, we expect 1 per post. Prescribing assessment, we are looking for 1 done in your ST3 year, and your leadership assessment, we are looking for 1 as well. And on your compliance passport bit of things, we are looking for BLS for child and for adult, and this is a statutory requirement for every doctor, and we expect that to be done and present annually, and we also expect a reflection to be done on that. We expect child and adult safeguarding level 3 as well as a reflection of that to be done, and we expect a completed form R. And finally, in terms of the KEBS, we expect prostate examination, rectal examination, female genital examination bimanual, female genital examination speculum, breast examination, as well as male genital examination. So if any of these is missing, then it could cause a non-standard outcome. Number 2 reason why trainees fail ARCP is poor CSR and ESR report. After every rotation, you are going to have a clinical supervisor's review, followed by an educational supervisor review, which should be annually. But in some cases, you could have an early ESR. Now, come to think of it, if your supervisor who is right with you, who sees you in the clinical setting every day, isn't happy with certain components of your performance, what reason could the panel possibly have to be happy with you? Although there are exceptions to this, If the panel goes through your portfolio and they disagree, the panel will still give you a standard outcome. But when there is a bad CSR and ASR outcome, it's a little difficult for the panel to go against what the educational supervisor and the clinical supervisor, what they've noticed. Number 3, which is the leading cause of a non-standard outcome in ST3 trainees, will be failure in exams. If you're going for your final ARCP and unfortunately you've not cleared both college examinations, the AKT and the SCA, you can expect a non-standard outcome. Number 4 reason why trainees fail ARCP will be poor quality of entries and reflection. One of the most important things the panel is looking at is that the panel wants to see the progression of the trainee. They want to see the progression in the quality of the entry of the training, starting from ST1, and they like to see how they've got better along. If the trainee is then showing signs that demonstrate that they are not making any progress in terms of the quality of their entries, then this will cause the panel a lot of worry and may lead to them awarding a non-standard outcome. Number 5 reason why trainees fail ARCP is inconsistencies in the Form R. The panel is going to go through all the educators' notes and they are looking for significant event and learning event. And they expect that the trainee has then brought this up as significant event analysis and learning event analysis. And they have then put that in the Form R. If a trainee hasn't done that, that would worry the panel. If a trainee has done that, but they've not put it in their Form R, that will worry the panel. Number 2 thing about the Form R that the panel is looking at is that they are looking at the number of days spent as time out of training. And the panel expects these days that you have declared in your Form R to be consistent with that is present in your portfolio. One other important bit that the panel is looking for in your Form R is whether the previously mentioned significant events that is ongoing have been resolved or not. If there is no evidence to show in your Form R that they've been resolved and you had declared them previously, the panel will be worried and this may lead to an award of a non-standard outcome. Number 6 reason why trainees fail the ARCP is poor time management. What do I mean by poor time management? In the run-off to your ARCP, the panel expects your ESR to be done and completed not earlier than 8 weeks to your ARCP, but also no later than 2 weeks to your ARCP. What we usually then find is that you see a lot of ESR done late, and you see a lot of trainees putting evidences a day or two to ARCP. Now, members of the panel tend to pre-screen your evidences way before so that they have a full idea of what's happening with the training. By the time the training then puts in an evidence a day or two before the ARCP panel, it then creates more difficulty and of course more work for the ARCP panel. The last reason why trainees fail their ARCP is poor understanding. What do I mean by poor understanding? The commonest example that we see in panel is trainees confusing a QIA for a QIP. A QIA, as you know, is your quality improvement activity. A QIP is a quality improvement project. A QIA tends to look at your own practice and look at ways to improve your own practice. It could be about your prescribing of antibiotics. It could be about how you're monitoring medications that need monitoring. QIP, on the other hand, tend to be broader and it tends to involve issues relating outside of you. issues about you and also about the broader organization. What is the organization doing wrong? So trainees tend to mix this together, and that is a big problem at ARCP panel. Number 2 problem, as far as poor understanding is concerned, is leadership. You see a lot of people doing a QIP and then saying it's also their leadership activity at the same time. That is not going to fly at the panel. If you've done a project and you intend to use it for a QIP, use it for a QIP and then do another leadership project. Another misconception that tends to happen about leadership is trainees then make the mistake that presenting in VTS or leading the VTS half-day release constitutes leadership. This no longer constitutes leadership. Whatever you've done or whatever teaching you've done, has it led to a change in the approach in your surgery? That will be leadership. Have you chaired the practice meeting? That will be leadership. Have you chaired the safeguarding meeting? That will be leadership. Have you done a project that has led to a change in how things are done in your organization? That will be leadership. What does not constitute leadership is being the admin of a WhatsApp group. That does not constitute leadership as far as the college is concerned. And the number 3 problem when it comes to poor understanding of concepts is the issue of PDP. You see a lot of the PDPs of trainees not being smart. As you know, it has to be specific, it has to be measurable, it has to be achievable, it has to be relevant, and most importantly, it has to be time bound. So you see a lot of PDPs not being smart, and that is a big problem. So guys, those are the 7 reasons why trainees fail ARCP. Please go through them one after the other, making sure you do not fall victim of any of them. If you have enjoyed my video, please do well to subscribe, like it, share with your friends and colleagues, be your brother's keeper. Thank you so very much, and I'll see you in my next video.